we've done this before. We've talked about the coronavirus, I mean, the coronavirus, and everything along with it. That back, when did we
At
do
the
that?
beginning of this, I
March,
was, I don't
April,
know if it was March. It might have been the beginning of April.
beginning of April, and
We were still in
now,
the full lockdown at that time.
correct.
Yeah.
And now we are going into August, and there's school opening. There's talk about the antibiotic, not antibiotic. You're the
Vaccine.
doctor. The vaccine. So we have all this other stuff to talk about. Let's start with the basics. We're seeing another spike in areas that didn't have it before, and areas where it's warm, and we thought that wouldn't be a problem. So, what are you seeing here? Because you're in southwestern Pennsylvania with me.
Correct. I mean, in this area, it's still low, but the numbers are continuing. We're seeing probably more cases again, maybe because we're testing more. There was some testing issues at the beginning. We had minimal testing supplies, so we were testing only the people that had a set of symptoms. That kind of evolved now. The hospitals are now testing pretty much anybody that comes into the hospital that's going to be staying in the hospital. They're testing anybody who's going to be in the OR. So any of the and then again, that opened up. We initially weren't doing elective procedures, but they are now. So anybody who's having an elective procedure gets tested before they come into the hospital. The testing has improved, so we are doing a lot more testing now. So we are seeing more numbers of testing. What I'm seeing though is mild cases. The first couple cases that I had were hospitalized patients. I haven't had a hospitalized. We have we call it the code for the COVID patients. It's isolation area of our hospital that has three rooms in it for the patients, and we haven't had an occupying person in over 6 weeks.
Do you think we're seeing a weakened strain because we're into summer, or is it just the people that are getting it now aren't in that high risk group?
I mean, that's a good question. I think they think that there's a couple strains out there, and then this may be a weaker strain. Is it because I don't know that answer for sure. I do know that the deaths are, the numbers in those spots that you're talking about, some of those states, the mortality rate isn't what we saw when New York was having these spikes, which is great news. I mean, that's actually very good news. The question is, is it a lesser strain of a virus? Is it that we've learned some more things about the virus and how to treat it more appropriately? Is it some, ways that we mitigate things to keep some of the high risk people safer, and that may be why some of the mortality is lower? It's probably a combination of all those, kind of all those things. So, unfortunately, this is evolving again, and it drives everybody nuts because we get some information, and then 2 weeks later the information is changing. So, unfortunately, we're stuck with that kind of issue, and it makes it difficult to plan for this, especially when you get politics involved, and then everybody wants to say, hey, so-and-so this or so-and-so that. Right. That's not what they told us before.
We had talked about the first time that they were moving away from using ventilators because it was harder on the lungs, and so we kind of pushed out of that. I do know a couple people that have had it, and one was hospitalized, two were not. and they had mild symptoms. As far as the lungs go, the one had a lot of the throwing up and stuff like that. But there's a couple different issues there. One got the test back right away. One, they said, had pneumonia, even though people around them had tested positive. And one has been waiting almost 3 weeks and still doesn't have their test result. They've been through it healthy. If they'd have had it when they were quarantined, they'd be out of it by now.
Well, I mean, that's it. I mean, when I say there's more testing available now, we're still limited in our testing. Like, we can't just go out and test everybody, let's test everybody for this. We don't have the resources to do that. And unfortunately, in Pennsylvania, what happened was the mandate for the nursing homes, because they were such a high-risk population and there was such a high mortality rate in nursing homes. If this got into a nursing home, it was going to cause a lot of death. So they changed to the way they were doing that. All nursing homes are not allowed visitors. Some of the nursing homes, they all have different policies, which is kind of, again, crazy how it goes. They're all told to make up their own policy based on what they think is right. It's kind of, that's great that they have the freedom to do that, but in this situation, I would appreciate if they were to be a little bit more, this is how we would like you to do this. It's a little hands-off-ish kind of thing, like, we don't want to be the blame if you do it wrong, unfortunately. But anyway, irregardless of that, so they all have their own policies. I'm not even allowed into some of the nursing homes that I go to because I see other patients and potentially have a risk. And I had that mitigation for the nursing homes initially when this all started, when we thought it was going to be, I think we thought it was going to be a little worse, especially in this area. I'm not saying that it wasn't worse nationwide. I think this area, we didn't get hit anywhere near as initially what we thought we would get. So with that mandate, they all residents at nursing homes and all staff at nursing homes had to get tested between the end of June and July 20 something. They all had to be tested, and then they had to make a plan for how they could proceed with maybe letting visitors in and easing up some of the things, since technically the nursing homes are not in the green phase. They're still in the red phase, even though other businesses and stuff are still in the green phase. They're in the red phase, so that's what they were mandated to do. So with doing that month really stretched a lot of those resources. You're talking 1,000, probably potentially 1,000 tests from each nursing home. Right. So and then if somebody ended up positive in that nursing home, then they had to have 2 more tests for everybody else to make sure that nobody else got positive while they were waiting. So it just became a
backlog
of all these tests being done. So initially, we were getting our results back when this first started, 10 days. And then it got much better. We got our tests back within 48 hours, sometimes 24 hours. And then when that hit, we were back to 4 to 5 days.
Right.
It was just taking longer. Now there is the 15-minute test, right, that all hospitals are using, obviously, and depending on, I don't know what it costs. I do know the pediatrics office in our area did buy the machine, and they're using it, and anybody can actually pay cash. I think it's around $50 if you want to be tested, and it's a 15-minute test, but they say they call you within an hour and tell you what your test results are. So that's great. If there was more of those around, that'd be good. we're testing everybody, and we can't get them into a nursing home until they test negative again because of all those issues.
Right.
Which is really delaying a lot of issues with getting people placed in nursing homes. But this guy was admitted this morning, and they called me this afternoon and said, hey, his COVID was negative. Like, wait, that was like 4 hours ago.
Yeah.
And they said it's back. And I said, okay, great, that was good.
And one of the things I had heard was because we don't have a federal system that's handling all this testing, that because it's down to the states and however else, wherever you're sending the test to, there might be an area that needs the agent to run the test, and there might be an area that has a whole bunch, but there's no networking there. So there sometimes it's you luck into getting into that vein where you can get it real quick, or you luck into that vein where you have to wait for 3 weeks. I just hear multiple things. I just know a lot of people are waiting for tests, but more tests are coming back negative than positive, which is a good thing, right, for now, unless you're hoping for that herd immunity thing, and then we kind of have to, start having people lick doorknobs.
Yeah. Well, that's one of the things you look at and you say, really, if this current strain, like, these hot spots that we're talking about, now there's still mortality to it, but it's less. It's significantly less. Right. If you look at Florida right now, they have, in terms of number of cases, they've surpassed New York State in terms of number of cases, but their mortality is a quarter of what New York was. Right. So that's really a good thing. So you look at that and you say, well, if the strain is weakened, and if it's going to stay weakened, and it potentially, if we get a second wave, which we didn't even, we are getting little waves. We're not done with the first, but I think every expert kind of expected this to be like the flu, or like H1N1, or the Spanish flu even did that. It kind of went away when it got warmer, and then it came back. So that was the second wave they were talking about. But if you're worried about even a strain, it mutating again and becoming a stronger strain, do you kind of open things up a little bit more now to build up herd immunity? You know what I mean? Like if it's not as, if the virus isn't if the mortality right now is not as bad, do we open up? There's a lot of things there. I mean, it's just, again,
from a business perspective, you run the risk of having to close your business down because X number of people tested positive, and they're still saying they have to quarantine. You have to take all. So if you have 10 people work for you and 5 test positive, you're closed until everyone comes back.
Correct. I mean, and one of my staff went to Georgia. Mm-hmm. Her family's in Georgia, and I didn't think anything of it until, wait a minute, that, that's on the list of states. So we had to research that, and we actually came up with a policy on how to deal with that. Because if she comes back and she's positive and then not only puts my other employees at risk, it puts my patients at risk. Right. But I mean, there's all kinds of things that we're coming up with that we have never come up with before, and it's crazy. But like I said, but the question is I don't know. You got the problem is, again, politics get involved. You get one expert that wants to say this thing and one expert that wants to say that thing, right. And I think they should get all the experts together and just say, let's come up with a comprehensive plan and stick with it.
And it comes back to what we talked about. You as the federal government can't make the states do things, but they could have said, here's a plan. Can you adapt this to your state? I think that would have helped in January. Now, like I said, we're a month away from school starting, and every district has a different plan. They don't know if they want to go this way or that way, or you could let the parents pick. They can do whatever they want to do.
Right.
And the teachers are lost. They don't know how to prepare. The students don't know how to prepare. It's a nightmare. And like you said, no one wants to be the person that makes the decision. The government doesn't. The governor, excuse me, doesn't. Secretary of Education doesn't want. I hate this delay. It's killing me. The Secretary of Education does not. The local school boards don't. They just send out a survey. What do the parents want to do? And then I look at it as if something happens and there's a spread in the school, they'll say, well, you chose this. This is what you decided to do, not our fault.
Well, I mean, here's the thing. I mean, I've seen people saying about there that we should not open our schools until there is no risk. Well, the problem is, here's the thing. It looks like that influenza is going to kill more kids than this COVID-19.
Right.
Because it doesn't seem to affect kids, which is crazy, especially 5 to 15-year-old kids. It's like weird. And those are the kids that are picking their nose and touching their faces and slobbering all over each other. So it kind of is weird when you think about it. But right now, the data looks like these kids are not, number one, they're not getting it, and they're not really vectors. They don't look like they're vectors to spread it. So when you look at that and you say, look, if it's less than, if we're going to say, hey, we can't send anybody back to school until this is gone, then what about influenza? Because influenza kills kids.
Right.
Just because it wasn't talked about, you know what I mean? And then, what about, motor vehicle accidents? About 4,300 people or 4,300 kids die every year, roughly. Now, that's with mitigation, right? That's with speed limits. That's with seat belts. That's with airbags. Without those mitigations, what would that number be, right? So,
I agree.
So that's what people are going to understand. Like, there are risks in life, and we can't totally put our head under a rock and wait till this goes away.
No, so you could be talking 3 years.
Correct. And then what you got to take into account is what is the health risks of staying the kids at home. You know what I mean? Social isolation increases suicidal issues. Anxiety will increase. Depression is going to increase. I've seen it already in my patients that depression and anxiety have almost skyrocketed right now. You know what I mean? I think we're all experiencing that.
We've also discussed the food, because sometimes that's the only place where a student will get a good hot meal.
And abuse.
Child abuse. Right.
Child abuse.
That's the only place.
That's the only place that's identified. The teachers, the principals, the counselors. Yeah. They know these kids. They find things that it's another set of eyes on these kids that aren't on these kids right now. So there's a lot of bad to not opening the schools.
Yeah.
And
but I think that speaks more to problems we have in this country that just got the light shined on them. That we rely on the school districts to feed our kids, to watch our kids, to babysit our kids while we're at work. We rely on the school districts to do all of that stuff for 9 months out of the year. And then when that's taken away in an emergency, we don't know what to do with our kids. Well, maybe we should have been thinking about that for the last 30, 40, 50 years, as there's more two-parent working homes and things like that. But again, I think the pandemic has shown us more of that, and that's why we're worried about it now. And I'm good with us being worried about it. I think this is something we need to think about Definitely. Same as people want to think about, we don't know for sure whether the kids can transfer the disease or not. They might not get sick, but if they stay with a grandparent after school till their parents get home, and that grandparent is within that one of those high risk groups, then you have to worry about that. And what I keep telling people is that we won't know until it's over. We can guess and we can do studies and we can do our thing, but we're not going to really know. So I'm kind of with you that we just kind of have to do something and see what happens. But then I
think there's some data out there already that shows that they're not the vectors that the adults are.
Correct. That I get that. I get that. But then I understand the other side of it, which is if only 1% of the population dies from this, and that's a lot of people out of 300 million people, and no one wants anyone to die. But like you said, you can't control that. You could die from the flu. You could die. You could die in a car accident. The bus could wreck on the way to school.
Yeah, that's
where
what
they don't have mitigation.
What is an acceptable loss? And saying there's no acceptable loss is unrealistic, right? Because we can't live in a bubble. Right. There's risks in everything that we do. So, like I said, it looks like the flu is going to kill more people than this virus, or not more people, sorry, more children. Kids than this virus. It looks like that. So, and we send them to school, which is a risk for them. Now, I understand the teacher issue, and again, there are probably older teachers that have concerns because they probably fit in a high risk category. They might have diabetes, high blood pressure, heart disease. I think there's ways to mitigate that. Again, nobody is saying, "Hey, let's just send our kids back to school because there's no risk for them, and let's just go back to the way it was, and everything will be willy-nilly, and everything's going to be great." Just like Walmart had to change things, and all the restaurants had to change things. I think that's all people are saying is we can. All these other businesses did this and mitigated. Did some mitigation to help reduce the risk, and there's no way to 100% keep this from spreading. Exactly. But do our best. Come up with a plan so that we can do what we need to do. For instance, some people are saying, these teachers, they're going to be exposed to all these kids, and that's so risky for them. But what about the the person checking you out at Walmart? Right. They're seeing hundreds of people a day, different, but every day. You know what I mean? So they're
the essential worker.
Yeah, they're the essential workers, so they have to go to work and be there, and so
they don't have to. I go to Walmart and take whatever I want. They don't have to be there to check me out.
They don't have to be there. Well, they have the self checkouts, right? Yeah. But yeah, so there are issues that that. Again, if you do mitigation, I think that's the most appropriate thing. Obviously, if there's some risks, because this is happening in every industry. Right. There's people that are feeling they're high risk. I have patients that feel that they're high risk. They don't want to come back to work. That I think is fine. But there's probably a lot of teachers that would want to go back to work.
Oh, there are. They want to go. For the same reasons that we talked about. Sometimes they feel like the protector of those children, right? More than anything else. They want to educate. They want to do their job, but they know that they're going to see those little kids every day, and they know which ones aren't eating, and they know which ones might be in a bad situation at home.
Right. So
you can see.
We see her.
I'm going to have to edit that out. Apparently.
Why didn't she crawl? Why didn't she crawl underneath? Like
she didn't crawl this time. I don't know.
So there's. I think it's I think we got to get our kids back to school. Is my personal.
I agree. But I think
and I'm not saying, let's pretend that it's we're good enough to just send it back like we did before. That's not what I'm saying.
Okay, so full disclosure, you and I talked on the phone last week, and we're both to the point where we just want normal. We want normal.
True.
Even though we weren't so much affected by it, we were both obviously essential and working, and our families were. The kids were out of school, but our lives pretty much went on. But it would be nice. But it would be nice to not be afraid to go do things and see people. And we've had a funeral, we've had a graduation party, we've had things like that going on, and we've been careful. But you and I both agree, if we just went back to normal tomorrow, we'd be like, okay, let's see what happens.
Right.
We also both agree that if on November 4th after the election, all of a sudden nobody's worried about this anymore and we go back to normal, we would still be happy. We would just only vote for one party the rest of our lives. We've agreed on that.
I think we both agree. I mean, we're both a little different politically, but I think we both agree there is some politics involved in this. We both... The virus is real, people. Mm-hmm. The virus is real. There's we're learning more about it every day. Unfortunately, that makes things, information change on a, sometimes daily basis on what we should be doing. Masks help mitigate this. So, people should be wearing their masks. Mm-hmm. However, I really think it's crazy for people to be going up to people in stores and saying, why are you wearing your mask? Because guess what? Now you're getting away from the social distancing. If you see those people, just stay away from them. First off, you don't know, maybe they do have asthma or trouble breathing or anxiety, PTSD. Why do you have to police that? I mean, just stay away from them,
Last time we talked, I told you in general people are stupid. I forgot to add that in general, people are assholes. And if they think they're right, they're going to tell you. And we've really reached a point in this country. I don't know if it's in the whole world. I don't know if it's because of social media. I know we both think social media makes people a little braver when they're online. But I think some people have lost that respect for other people. There's a viral video going around today about a lady yelling at a child for not wearing a mask. And I didn't watch it, but I saw it was passing around. People don't think anymore. Now, I've been out, I wear my mask, and I've walked past people talking without their masks on about how dumb it is to wear a mask. And I just think, please don't say anything to me, because I know I'm a smart ass, and I will say something back to you.
Right.
And I don't want to. You don't want to wear your mask? I'm going to avoid you. Don't worry about it. We're all good here. Don't touch everything in the aisle on your way down, but it's okay. I'll wash my hands. We'll be all right. But in general, people are rude, and I think not everyone, but
not everyone.
In a situation this,
it gets like a mob mentality.
Right.
People on one side want to say, "Oh, you guys are being sheep for wearing a mask." Guess what? It's not going to make me a sheep. If this helps things get back to normal, if the restaurants are going to stay open, so. In other stores stay open, I wear my mask. Yeah, and
other countries do it. We talked about this.
I mean, the mask isn't comfortable. I don't like wearing it. I wear it all day at work now.
You're a different situation there.
Yeah, I wear it all day at work, and I like to not wear it. In fact, I have a deaf patient, which I like to see him on the schedule because he can only read lips, and so I have to take my mask off to talk to him. So, although I'm going to work on learning sign language.
Wear a mask more often.
But again, I think they want that viral video of, hey, look, I found somebody without a mask. I'm going to go up and confront them, and I'm going to go viral with this video, and look at the hero that I am, and it's like,
it does
really?
get frustrating
Are you doing
when you see large groups of people not wearing them, like when they're not socially distancing and everything, because it's, and you hate to say it, but it's more political than it is scientific. They believe in a certain way, and that they're not going to wear them. And you see ones that do, and you go, ugh, why can't more people just get it? Just put your mask on. An hour. It's not going to kill you, probably. Although, depends on what you believe online.
No, it's not going to kill you.
I want to talk about a vaccine, but I want to go back to something you said about how 5 to 15-year-olds, data is starting to show that they don't get it, and they don't seem to be a carrier of it. Do you think, and I just ran through my mind, this is one of those, can we shove a UV light up our ass and cure it? But it just literally ran through my mind, and I probably shouldn't say it in public. Do you think it's because their immune system, hasn't developed as much as an adult? So, for example,
that's a good question. Well, that's a good question.
We talked about how, because we've never had this before, this virus, our immune system overreacts, and sometimes it's your lungs, and sometimes it's your whatever. Their system is still in the learning stages, and they get that and go, well, we haven't had this, but we also haven't had to react to a bunch of other things either. So
that's a good question. I mean, is it because, I mean, we do know that some of the people that are having issues, it's because their immune system does overreact.
Right.
That's why they're using steroids and stuff now, which has helped. But I don't know how. I mean, the virus, which if they're not having immune response, then the virus would be able to replicate more in their system and have a higher viral load.
Right.
Which that's one of the things they're noticing, that a higher viral load is more with a higher disease too. That's why they feel that the masks do work in that respect, because they can actually decrease your viral load if you get it. So again, the mask works really for you to keep spreading it from somebody else.
Right.
But they're now looking at it and saying, maybe it does protect that person a little bit, so that they have a smaller viral load if they do get exposed. And then they're able to fight off the virus a lot easier if the viral load is smaller. Do you understand what I mean? Like if somebody coughs on you without a mask and all this virus is in the air and you inhale it, that's a big viral load. But if you, if they cough on something and then, later on you touch it and you wipe your face and get it in your eye or something like that, that could potentially be a smaller viral load. So they're thinking that there's something to do with that too, that if you get a smaller amount, that you may be better off. You won't get the disease the disease won't hurt you as bad.
The same theory of a vaccine, that you get a deadened version of it.
Correct. Well, it's a little different. I mean, you have a little. If you got
I didn't spend 20 years in school to be a doctor.
So if you get a small viral load, that means it's going to take a while for the virus to replicate quicker into your system. Right. You get it,
right?
So it's an interesting thought. I don't think that explains the kids though.
Yeah.
I don't know. It's a mystery. It is a mystery because like H1N1 killed kids,
right?
And it made sense because it was a little bit different of a strain, and apparently older people had seen something like that before, apparently, and they had a little bit of immunity to it. But this is new to everybody, and it doesn't seem to be killing kids as significantly as it is adults.
Like Logan's Run.
Correct. Yeah.
Right. Which we're well above the age where they'd have thrown us off the cliff. So.
But you're older than I am, so.
By a little bit.
Yeah. Well, we'll let the
Respect
audience decide.
Anyway, so vaccine. Well, before we get there, where are you? We talked about this last time on people who are high risk, like elderly, maybe certain diseases that are more susceptible than others. Where are you on them going out in public and doing things right now? Right now,
I think it's still, you got to look at your area. That's, obviously one exposure is all you need, but your chances, if you were in Dade County, Florida, your chances of getting exposed are significantly higher than if you're in our area, because there's not a lot going on, that not as high as a number of people having it. So I mean, that's one of the things you got to look at, and then you got to understand your risk versus obviously if you're elderly, you have some medical history, you really want to be careful. You want to probably not go out as much. Now, full disclosure, my mom has gone out now. I told you last time that I had her locked in her apartment. I think she's ready to go nuts, absolutely berserk. She would call me every day and ask me something different. So we released her. Initially, she just came over to our house, and we took her to the lake, and on her boat. She was just with our family, but she decided with that freedom that she would go a little bit further, and I explained it to her that that's a little dangerous, her going shopping and stuff, and
but she's your mother and she will do what she wants,
right? And she basically said that I had enough of that sitting in my apartment, and so that's where it is. I mean, I still do tell my patients that they should be, the elderly really shouldn't be going out. They should be staying in. They should be, getting their kids to get them things, and because those are the high risk people, and that's the people that we really should be protecting. And that's what like when we were talking about the teachers. If there's somebody that high risk, we got to figure out a way that maybe they don't come back to teach, and maybe maybe you have a substitute or somebody there, and they can do video classroom work from home with the kids in the school. That's a thought.
It goes back to, we did not invest correctly in our educational system for a long time. With the technology we have, we should have been able to snap right over, which should have been, here it is, here's what we're going to do, here's our plan just in case, and boom. But
again, technology isn't as great as, when we were trying to set up here, we were joking about technology. Right. It's not as great. It's perfect, I mean, it's great. It is great, but it's not perfect, number one.
Right.
And then a lot of people aren't tech savvy. I mean, have the teachers be tech savvy. I mean, maybe you're right. We should have been prepared. And
I really think we should. We talk about how precious our children are and how important they are to the future, and then we don't invest in air conditioning in our schools.
Oh, I agree with that.
Or even something as simple as the online process. Because there are snow days here, especially there's snow days and things like that. Those kind of things should have been built into the system a long time ago. Not running for school board, just saying those things could have been, but that involves
if
money.
Enough people write Glenn in, he will take the job.
Yeah, I've considered that, but
he won't say no if you know what I mean.
As an aside, I figure that I'm better off. I would be doing the same thing I'm doing now. I'd be out there explaining why everything's wrong, trying to tell the people who make the decisions, and then just being outvoted. So I might as well just do this without the stress and without having to sit through a meeting. Thank you. Yeah, thanks. I'll edit that part out. So, vaccine. Depending on, I just heard this morning, they're saying maybe 2021 now, just depends. They'll have a vaccine and enough of it to distribute widely. I'm not so much concerned about the time frame, because you and I have talked about this before. You don't want to be the first one to take it,
Right.
and
You don't want to be last.
you don't want to be the last one to take it.
That's one of the things that somebody told me in medical school. You don't want to be the first doctor to prescribe this medicine, but you don't want to be the last either. Right. So you kind of have to figure that out. Yeah. In this case, it's going to be a little different. There's people signing up for this trial. This trial's going on right now. 30,000 people, I think they're doing in this trial. So, I mean, that's pretty quick.
Yeah, we moved it along really quick. Which, again, if you put the money behind it, you can get those kind of results really fast.
Yep. Necessity is the mother of invention, right?
Mm-hmm.
So
and cash is its dad.
Yeah, I don't know.
Well, it just means that
cash.
We worked for years and years and
cash.
years. No, cash. Cold hard cash. Yeah, not cash. Right. Not four-legged. No.
Okay.
No, that would be really stupid, and I don't know why you thought I said that. But yeah, I mean, they put all this money into it, and they put the best minds to it, and boom, we're years ahead of where we should have been with the vaccine.
Right.
But I still don't know if it's safe.
Right, that's the thing. It's going to be and again, it's going to come down to what's the actual what else had we learned about the virus at that time? What's the mortality rate at that time? Right. What other things can we do? It's a bunch of variables that you have to take into account. I mean, it's not black and white. Nothing ever is. We've talked about that before. Nothing is ever black and white. It's all shades of gray, and you gotta do your best to pick the right path. So if this vaccine comes out and it has a good success rate, and the mortality rate is staying around 1%. And probably gonna go for it. Right. If the mortality rates drop down to 0.2% and the vaccine has a 50% chance of working, there's all kind of variables. So.
Yeah, it's and you have people who won't take a vaccine no matter what, and you have people who have signed up for it. And you'll have people who they'll say, you have to have this. Maybe school-age children, where they're going to say, well, you have to have the vaccine like you have to have for
everything else.
Or whatever.
Right.
But there's a difference between the measles vaccine and something like this, which might be more like a flu shot, which isn't required to go to school.
Smallpox was required.
Yeah, I remember. I still have the scar.
I used to have the scar, too, yeah. And it was eradicated.
Yes.
Because it was required. So, I mean...
If this would do that, but we still don't know if it's more like the flu,
that's what I mean. That's one of the variables that we don't know yet. We don't actually know what it's going to do. So, that's what I mean. Like everybody says, oh, great, the vaccine's coming around the corner. Well, we don't know. First off, it's in the early stages of the trial. It does look very promising. I think they said, the monkeys, 90-some% did have good results and stuff like that. So, but again, by the time the vaccine comes out, does this virus, run its course and it's through everybody,
If you're talking spring of 2021, we're through the next flu season, and you might have that more of that herd immunity, and like you said, we don't know if there's a weaker strain of it now. We don't know if we're adapting to it. There's a lot of questions, and we talk like this trying to come up with some sort of answer or guidance or whatnot, and it always comes down to you have to decide for yourself. You have to say, is it worth the risk? Whether that's going out right now or whether that's getting a vaccine in 3 months, 5 months, 6 months, whatever it is. no matter, you'd have to do your own research and be open to outside information for the most part.
Correct.
Because there's always a little crazy. He said not wanting to go any further than that.
There are. Are you talking about the alien?
I'm not talking about anything. I'm not talking about anything. I'll get yelled at. I'll get yelled at. As soon as I post this, I will get yelled at if I start.
Well, let me. Since you brought it up, let's talk about that.
Okay.
Because I think it's important. Again, we're both on two different political sides,
right.
Correct?
Generally, we meet more in the middle than most people do.
Right. And when I first saw that video, like everybody else, I accepted it at face value. And then when I saw other people putting that video down because of the one doctor, and then I looked into her a little bit more, and she has some different beliefs, let's put it that way, okay? But that wasn't, so here's the thing about that was, first off, she pushed the envelope more than the rest of those doctors did, in terms of what she was saying, in terms of hydrochloroquine being a cure, and masks not being necessary. Some of those other people were not as extreme as she was, just like in the political spectrum, there's different degrees. So not all of those people were as extreme as she was, but that's kind of who they focused on because she has the chink in the armor to discredit the whole group.
But then why was she there?
Huh?
Then why was she there?
Because
I did have to look her up too, because there was all that going on. And
well, first off, she is a physician. She's a licensed.
Correct. Yep. Pediatrician. So 1984 or something. Yeah.
Right. So she is a licensed physician. Number one. So I didn't really look into it a lot. I just know that they're quoting her as saying one thing, which I think more of a paraphrase. I had this discussion with one of my. Now, I'm not saying what she said in that what they're quoting her as saying about having that women problems such as endometriosis is caused by women having sex with witches and demons. But I don't think
about it. Yeah.
Right. I don't think that's a direct quote of hers. I think is it a direct quote?
She has YouTube videos. Yeah.
Okay. Well, I didn't see that, but I was just saying, she's Nigerian, number one, so it may be a cultural thing.
Right.
And I was discussing this with one of my employees who happens to be Catholic because she couldn't believe that somebody would think, because we were talking about Chinese medicine, and Chinese medicine, they believe in evil. Mm-hmm. Evil. There's bad chi, right? Bad energy. And I was kind of equating it to that. I said, maybe that's what she kind of was getting at, and that's just a cultural thing for her. Right. My employee's Catholic said, well, I can't understand how the Chinese people believe in spirits helping them. And I said, wait, you're Catholic? And she said, what do you mean by that? I said, don't you guys believe that saints help you?
Yeah. She
said, well, yeah, but that's different. And I'm like, okay, but culturally, do you understand? Maybe there may be I agree that what she's saying is crazy if that's indeed what she was quoted as saying.
Right.
But there may be an interpretation thing for her culturally.
Right.
Irregardless, there were other physicians there.
Correct.
And she is a physician, number one.
Right.
I think she went a little too far with what she was saying. I think there is some credence to what they were saying. Like, we can't go.
Where'd you go? All right, it's recording again. And now I'm back to the delay, which is blows. So that means you have to go back and start
Okay,
all
let's
over
go back.
again with
So we were talking about
Dr. Emmanuel.
the
Cultural
Nigerian
differences and stuff
doctor
like
and
that.
cultural differences,
Right.
and I don't remember what we got, where we were at exactly, but I'm not saying that she's not out there. I'm just saying that there may be some cultural differences,
Right.
in terms of she's Nigerian. I do acupuncture, so I know a little bit about Chinese medicine, and they believe in bad qi. And is that something what she's implying when she's saying those things that may be a little foreign to us? Irregardless, she said, like you pointed out, she said some other strange things about alien DNA and vaccines preventing people from being religious or something like that. But she wasn't the only one there. And she so the other point I have is she would still be in a court of law. She probably could still be an expert witness for somebody medically, correct?
Right. Which,
I mean,
I'm going to jump forward to what we talked about when it wasn't recording right. What do you call the person who graduated last in our medical class? Doctor.
Correct.
All the crazy things in the world doesn't mean she's wrong about this one particular drug. And we'll summarize because we already went over it, but it has been used. It's not that you can't. It's
not FDA approved,
right? But
it's called using it off label,
right?
And the problem I have, let me make that point with Dr. Gupta. The president said he was on hydroxychloroquine, prophylactically taking it. Dr. Gupta they got him on. He's their medical expert. He said that it's irresponsible of the president to continue to tout this drug when it can kill people.
Right.
So he did the exact opposite of what the president was. The president is saying this is a good drug, we should be using it. Gupta saying this is a bad drug, we shouldn't be using it. Yep. The problem is it became political.
Yep.
He was doing the exact opposite because it is an approved drug for arthritic conditions and treatment of malaria. So there are people in this world that are taking this medication that is appropriate for, and Gupta implied that it's a bad drug.
Right.
The other thing is it is being used off label to treat COVID.
Right.
And there is a study that's currently in the process. Some of the studies have shown that there's no significant improvement in patients that are significantly ill with coronavirus.
Right.
As far as I know, there's a study that's still pending on prevention.
Right. And I think the issue was because that one doctor, and again we said I'm going to refer back to a few minutes ago when we recorded it didn't work. I don't know what everyone said because I didn't see it. It was down before I ever got to it. But I think there's that all or nothing rule right now, and it's if you tell someone it's a cure, we're taking down your information. But I agree with you that just gives the implication or it infers that we don't want you to know about this. We don't want you to know anything about it. Which just makes people want it more.
Correct. It was the wrong thing to do, I think.
Yeah.
And it fed into the conspiracy theorists that this is not as bad as it.
Right.
I think this is not. In certain areas, it's not as bad as we thought it was going to be initially. So that's the other issue. You got these people that are in these areas that see it's not as bad. We don't live in New York. We don't live in Miami, Florida, where it is bad. So that's the other thing hard to put your head around. And then when these tech companies do this, you think, no, there's proof. They're hiding something. They're hiding something. So,
and then the other thing,
I think that was the wrong thing to do. I don't know again, there's all these variables. What is the right thing to do? Do you counter that with somebody else? But then again, it's, the problem is in this world is you can get experts on both. You can get experts on both sides. If there's a medical lawsuit, you can have a pulmonologist expert on the defense side, and you can have a pulmonologist expert on the plaintiff side, and then they battle it out to see who. I guess that's what you got to do. Maybe is say, hey,
it's like we've talked about in the past. You could always find those people, but now with the internet, you can find them a lot easier. If you believe that the frogs are controlling you, ESP and telling you to never cut your grass, there is a group out there of people who will believe you.
And my mower was broken. That's why I didn't cut the grass. It had nothing to do with the frogs.
Nothing to do with the frogs this time. No. Right.
Right.
You can find those people. And the other issue is we want our information now, and we think we should be able to have the correct information right now, like we talked about earlier. Whether as science learns things, they tell us what to do. It changes sometimes. That's the point of science, is trying to find out if you're wrong, not to reinforce that you're right. That's what I try to say. And so when people see this works and then someone says no it doesn't, then like you said, they've staked their ground and they're just going to believe whichever one agrees with them. Meanwhile, the people behind the scenes are doing the test going, okay, well maybe. Well, no one wants to hear maybe. They want to hear now. They will, what can I do right now? Like we talked about, get it back to normal. What can I do right now? Right. And that's not there. We're still in the middle of, we're 6 months in. We don't know how long it's going to be. And that's the part that frustrates me, and that's why I enjoy talking to you, because you understand that we're kind of learning as we go, and this might change and that might change, and they might come out and say this HCQ is perfect for you in 3 months, and everyone will say, see, the president was right, and then everyone else will say that it was a fixed test and it doesn't work and they're not going to take it. And it's just like a vaccine.
Yeah, and that's, when they first came out and said masks aren't important, don't use masks, were they telling us that because they wanted to save the masks with medical personnel? Right. That confused things a little bit. Mm-hmm. One of the latest things I see is, if 80% of people would just wear masks, we would get through this in 6 weeks. I've seen that on Facebook. Now, my question is, I've seen other people quoting that, other professional people, smart, intelligent people saying that. Yeah. And I'm thinking, where does that come from? Because if I remember correctly,
what's the science behind that?
Yeah, what's the science behind that? It's like, if 80% of the United States would wear a mask, we'd be through this in 6 weeks. And I'm thinking, where did that come from? Because I don't understand it, because if I remember correctly, at the beginning of all this, we did, technically it wasn't a total shutdown because they left Walmart open, which may have been part of our problem. We didn't really do a good shutdown and say, really you should only go to Walmart if you have to get groceries, not go to Walmart every day because you like to go out and that's the only thing that's open. I think that's what a majority of people did. But I don't understand, we did a, essentially total shutdown, is best I think that we could do, and that didn't stop it.
No, I think we did.
And I don't think that was supposed to stop it. It was, it was supposed to flatten the curve.
Even
and that's a lot of other people's argument is we were told we were doing this to flatten the curve. The curve is flat.
Right. So now it's go back to normal.
Well, no.
No, that's what people were saying. They're saying it's we did what we're supposed to do. Let's go about our lives now, because they forget that the curve can go back up like it did in Florida and Texas and Georgia and Los Angeles. Where they're talking about shutting down again.
But again, the death rate in those areas are much less than they were in New York.
But doesn't it still put a stress on the hospital systems if you have people being, because Texas has like an 87% or something.
I think Texas is at a very close to capacity. I think New York is, but it looks like not New York.
Florida.
New York definitely was. Florida is currently at a capacity close to their capacity. So it's still straining the system in those areas. And that's the question: is this peak from? Is it going to go around to city? You know what I mean? Like, we don't know.
No, you don't know.
Is it going to come back in New York? New York looks great right now. Their numbers are
Everybody
down.
left. They went to Florida, Texas.
Correct. They went to Florida, Texas, and Arizona. Yeah.
And they're going to come home, and it's going to spike right back up.
Yeah.
You don't know. We just don't know. And that's my thing. I don't mind when they say that Fayette County had 100 cases or 60 cases or whatever every day. It goes up a little bit. I don't mind it because we're staying like this.
Right.
We're not doing that. If we start doing that, then you have to really adjust.
Right. Yeah.
You really have to slam the brakes on. And that's where politics come into it. If the governor sees this and says, okay, you can't do this, that, and the other thing, everybody blames him and not their own behavior that caused this. And that's what we started to say before we stopped recording on the last time. You have to separate the science and the politics, but I don't know where that happens because people don't
plus it's election year.
Well, that's the other.
That's the worst part about it.
Yeah,
and
even when it's not an election year, things are so
well,
bad.
no, but it's worse, I think, that because it's an election year.
Yeah, I mean, I agree. And, I'm no fan of the president, but I think he gets unfairly portrayed because of the way he says things. But on the other hand, I think he could say less. Does that make sense?
But that's just not his personality, though.
Right. I mean, if he wants to have,
I will say this:
a press conference, have the people actually running the committee or whatever it's called, have them speak, and then you'd still have the nitpicking, but he's such a lightning rod that you can't. People either hate him or love him, and they won't listen to anything else.
Right. But I think I will say this: I think Biden's biggest campaign is going to be after the coronavirus.
Mm-hmm.
I think he's going to go after Trump in that respect.
Yeah,
that's going to be the number one thing. My thought on that is this: if he has the answer, why do we have to wait till November to get it from him?
Yeah, and that's typical of a presidential campaign.
Correct. Yeah.
I have a plan.
I have the plan,
me, and I'll tell you.
I will get us through this.
Yeah.
And I will tell you November 5th.
Right. Exactly.
But not before.
No.
So it just is frustrating. It's like,
almost wish it was 2 years ago, and we could.
And then all the people on both sides on Facebook throw mud at each other now.
Yeah.
That's even
it's hard.
Part.
It's hard to have a decent conversation on Facebook because you can't tell tone, and then people you don't know gets involved in the conversation, and that makes it hard.
Correct.
Yeah.
And then you got the people confronting Karens on both sides: the Karens with the mask and the Karens without the masks. Right. And what's a male Karen? Is there such
a Chad?
Oh, it's a Chad. Seriously, you just made that up?
Yes and no. I've read that. That was the first one that popped in my head. I was going to say it, Craig, but I figured you wouldn't buy that. But no, it's social media brings us together, but it also brings in all kinds of different views, and it doesn't take much to set somebody off. Like I said, I did make a comment about the video that was taken down. I cited some sources on things that made it why it was taken down, and that caused a little bit of a kerfluffle, and so I just got out of it. It's you and I can have conversation. We've known each other for 30 some years, even though I'm much older than you.
I was gonna say I knew that when I was that young.
Yeah, well, 18. Yeah, so that's actually 33 years. Yeah, but anyway. So we can have this conversation, and we can agree to disagree, or we can reach a mutual point where we agree on things. But if we were doing this on Facebook, typing it out, then you would have other people jumping in, and then it goes off, and that's why that's not a good place to discuss things. On the other hand, I wish people would just shh and wait. They can't.
Oh, exactly.
Just,
I mean, that's the problem. Like I said, we're learning about this virus every day. Things are changing. We just got to ride it out. We can't. I wish the politics wouldn't be part of it. I wish we could get.
That's where we are now.
Obviously, we can't have one expert telling us what to do, because what I explained earlier is because it's a multifaceted problem. It's not just the virus; it's the economy, it's the schools, the business owners. It's multifaceted. So you got to get a group of people over, and there's no right answer either.
No, there's not. Except waiting.
There's no straight shot to get to where we need to go. We kind of have to meander through and bounce off of things. And like you said earlier, when we were talking about this the first time, you start opening up and see where you're at, and if things go crazy, then you got to change.
Right.
Same thing with the schools.
I acknowledge that the change is needed.
Right. Same thing with the schools. I think, at this point, with the information that we have, I think it's safe to send the kids to school, not like they went to school every other year. I'm not talking about that. I'm talking about doing some mitigations. And yes,
masks,
younger kids are going to have a problem with masks, but at this point, they probably have been wearing masks at least some part of the day,
I don't know if you saw the thing I posted. It was a joke about people who think that kids are just going to wear masks have never met kids, and people who think that kids aren't going to lick their hands and chase each other around saying you're going to get the COVID have never met kids. They don't take it as seriously as we do.
They're going to do that.
Yeah.
Huh?
Yeah.
They're going to do
spread. And it just, you can't stop it. We're fortunate, like you said, that the fatality rate isn't high. I mean, if this was killing 5, 10, 15%, I don't know what we would be doing. We would be done, because we can't handle this.
Correct. I mean, we would be living in our houses, and it would be, you would be post-apocalyptic.
Yeah. And we're talking, 1 to 2% fatality rate, and we're like, that's okay, that's fine. I gotta get to Applebee's. But
I mean, it's a good thing.
It is
that it's not like. Well, it's a good thing that it's not like the Spanish flu, because that killed 500.
Yeah. But again, the circumstances were a little bit different. That we were in the middle of the World War, and so a lot of that was spreading through troops moving from camp to camp to Europe and back. We did a lot of spreading of that because we were putting a bunch of people on a boat right next to each other.
But it's a good thing they didn't have social media back then.
Oh, well, they did. They had the newspapers. And the newspapers.
But it wasn't like what we have now.
Well, no. There were people arguing, why should I wear a mask? And they were saying, we need to close the churches. And then people saying, well, you can't close churches. It's America. It was the same arguments. It was just in letters to the editor instead of on Facebook.
But it took longer to get the information out.
That is, because there was more newspapers, and they printed 2 or 3 times a day.
Oh, did they?
Yeah. I mean, the information was there. It just that some people didn't believe it, and they would say, "We're going to have a big parade for war bonds because we need to raise money," and then 50,000 people file into downtown Philadelphia, and 40,000 people get sick, and you go, "Oh, they were right. You're supposed to stay home." Huh. Now we just say there's going to be a protest or there's going to be a political rally or something, and you go, "I'm going to be safe. I'll be fine. I'll live forever." And we don't. No one gets out of here alive. So just be careful.
Yeah.
Yeah, it's just that simple. Is there anything else we need to talk about? Vaccines,
I know
school,
vaccines,
old people,
school,
alien DNA.
alien DNA. That one I have to research before I give you.
I'll send it to you. It's again, doesn't mean she's wrong about this. It just means that's out there. Vaccines, something religious. I don't get that one.
What was that?
The vaccine to stop you from being religious. I don't get that one.
I don't understand that one either. No.
But I'm not the strangest thing I've ever heard. To tell you the truth, but I listen to a lot of weird things.
I don't know. There was a video online with her, and there was a white Black Lives Matter protester. I guess he was at that event that they had, and he was confronting her and telling her that she is not black on the inside. And it just,
which technically she's not. Technically she's not.
But nobody is.
Right, exactly.
Yeah, he was. I think he said something like he was blacker than she was, and she said, "I'm black," and he said, "But you're not Nigeria. Black." Correct.
Yeah.
So it was interesting. So it takes.
The beauty is being able to laugh at people.
Yeah, I mean, there are some people out there. I mean, you look at that confrontation, and so the problem is you shouldn't put all your eggs in one basket. Obviously, I think they were put up there by the Tea Party,
Breitbart, sponsored it. Yeah,
and I think they could have found. Well, like I said, she wasn't the only doctor there.
Right.
So, and again, just because she says these other things doesn't mean. I mean, hydrochloroquine is not a cure. Okay.
Right.
So she is wrong about that.
But it could be a treatment.
Could have been a dream.
No, you just broke up on.
Did you say it could have been a dream?
Could have been a treatment.
Oh, she could have been dreaming, I thought.
No, I'm agreeing with you that it's not a cure, but it might be a treatment in certain aspects or certain situations. Right.
And I'm not advocating it either.
Right.
I'm just telling, it has been used. Right. Doctors are using it off label. Right. It is prescribed for other things.
Right.
It's not as lethal as the media wants to make it out to be. The president shouldn't promote it, but CNN shouldn't, bash it either. So
just to break it down,
the scientists really figure it out.
Just to break it down, basically what you have to do is wear your mask, wash your hands, sanitize whenever possible, keep yourself as distant as you can, given whatever your situation is. And if you get sick, listen to your doctor. Don't go online and say, well, this worked for person A, so I want to do it. Or this person said to do this, so I'm going to do that. Or don't do something. Basically, it comes down to individual choice, being as careful as you can. And then if you do get sick, being careful then too, not just jumping into, like with any disease.
Right. You gotta first off, depends on how sick you are, what you're going to be doing. You obviously want to get tested to find out if you even have the virus, because there are other things out there still.
The flu.
Other illnesses haven't stopped coming around. So, just check with your doctor, get tested, and find out what's going on. And then, like I told you earlier, it's been 6 weeks since I had anybody hospitalized that has been positive. I've only had 2 or 3 positives in the last couple weeks. But I have had them.
Better of you living through this than anything else at this point.
The mortality is dropping.
Yeah,
for sure.
Yeah, which is a byproduct also of finding of the testing and finding out more people had it. We've talked about you get tested regularly. I've never been tested. I didn't have a reason to be tested, knock on wood, but I don't know that I never had it. I could have had it been asymptomatic and this never happened.
I've been tested 4 times because of the nursing home issue I was telling you about earlier. Right. But I also got, our hospital is doing research. They're associated with a research institution, and they did the antibodies on all the employees. And, unfortunately, I didn't have the antibodies either. So, you hope if you're exposed that you're going to get it a mild case, and then you don't have to worry about it anymore. But, then again, is that true? We don't know that either.
I had that conversation with someone who had
with the history of
and was sick. And he said, well, now I don't have to worry about it. And I said, you don't know that.
You don't know that. I mean, but most likely, if you've had it, you're going to have some antibodies. And they said, your antibodies may be gone within, such and such a time. Right. But that your body still will remember that, and your response will be quicker the next time, most likely.
You hope.
So, yeah, because we see that with the flu. That was that same thing with that H1N1, how, the older populations had some kind of protection from that, because they were able to, not die off as, their mortality and them were less than that.
Do you know if that worked the same way as COVID with the RNA and how it got in and replicated and everything? H1N1.
The H1N1. Yeah. It was a virus too, so it goes into your RNA and replicates, and that's it's not technically a living thing. It has to have a host.
Saw something off topic. Saw something on 60 Minutes last week about treating sickle cell anemia, and they had used HIV and altered it to fix the part of the DNA that creates the bad blood cells, and they injected it, and I can't do the science of it, but they were following this one woman and how fast her body, of course they had to give her a chemo to knock down her immune system so that it didn't reject the new DNA they were putting in it, and then how fast her blood fixed itself. So she didn't have those odd shaped blood cells anymore. And they had done it in, I'm going to get the number wrong, there's 70 people, and one had passed away of a separate issue, but all the rest of them had seen varying degrees of recovery. And the doctor who was behind it, the 2 doctors, said, I can't tell you this will work for everything, but that's the next step. If we can go in and actually fix your DNA and take that disease out of you, then you'll be cured. But he every time he said the word cure, he had to stop himself because he didn't want anybody to think, we've got it now. We're good.
We figured it out.
Yeah. It was just amazing to see where we are scientifically. We know the DNA. We know which letter is wrong. We fix it. We put it in your system. Send you out. And the body heals itself. It's pretty amazing.
It is. So, and we will get through this.
Oh, absolutely. It's hard to understand it.
One day it'll be gone.
Just be gone. Just be gone. Like a miracle. Gone.
Yep. It will be.
Maybe tomorrow or November 4th. One of the 2.
I'm hoping it's closer till tomorrow than
tomorrow would be nice.
But realistically, it's going to be a while.
Yeah, I'm assuming spring at the earliest. I think we're going to have to get through another flu season. Just because I'm a realist, I think that they're saying there's good signs with this vaccine, but every time I hear that, I just wait for causes somebody to grow a third arm. So we're gonna have to get back to that.
Could be useful. A third arm could be useful.
Oh, hey, if it was in the middle of my back so I could scratch that spot you can't reach, Yeah, that'd be fantastic, but I'm not counting on it. My luck, it'll be on top of my head. Never be able to wear a hat.
Still reach your back.
No, I have short arms.
Well, I was going to say, it depends on how long it grows.
I'd have to buy a third glove. That's all it would be.
You don't think industry would adapt by selling 3 gloves?
No. Mm-mm. You have to get a hat that had fit the arm and a glove on the end. Yeah.
No. But yeah.
Yeah.
Well, if the mortality rate's higher than it would. If it was a 50% mortality rate, you'd probably want that third arm.
Probably. Yeah, it'd be worth the risk. Yes. If it was a 50% mortality rate, yes,
that's what
I
I'm
would
saying.
risk getting the third
So it all
arm.
depends.
Right.
It all depends.
If we see that mortality rate jump as we get into the next flu season, we're going to have bigger problems than waiting for the vaccine. Because the politics are going to be even worse.
Correct. I agree.
Yeah.
If this gets worse in terms of mortality rate,
which is no sign that it will.
Then,
not yet.
There's no signs that it will, but it is possible because viruses have done that in the past.
Right. It can mutate and get stronger.
That's why I'm thinking, while it's mutating and getting weaker, let's just open her up and.
Yeah. You just want to go out.
I think everybody's ready to.
Yeah. We
be cautious.
Ate outside at a restaurant, and that's the first time we've been to a restaurant since March. Takeout, but never eating there.
I will be honest. We eat out. I feel very safe at a restaurant. I think it's safer than going to Walmart.
Yeah.
I haven't been to Walmart probably for 2 months, but when this first started, I went with Trudy to go to get groceries and stuff. And
right.
When we first were able to go to a restaurant, we did, and I felt completely safe. It was safer than going to Walmart.
Because
you were so separated from everybody else. And there's nothing on the table. They sanitized the heck out of the place.
They're being watched a little closer too than a Walmart or a Lowe's.
Correct.
Yeah.
And so, I mean, you got to look at again. It's again, you want to watch your own risk and what your versus your health and what you want to do. Just be careful.
Sometimes it's personal choice.
Wear your mask. If you see somebody not wearing a mask, just walk.
Slap them. No, don't slap them. Don't slap them. That's right.
Walk away. Don't put it on Facebook. You're not getting anywhere.
Yeah.
You'll get a couple likes, but the rest of us are shaking our heads.
We live in a weird world.
You just so they were not wearing a mask, and then you decided to stop the social distancing to go confront them. It's like not worth it.
Yeah. Plus, good chance you're going to get your ass kicked.
Yeah. Or if you're worried they have it, like they could cough or spit on you.
Yeah. Again, people are stupid.
I don't know. I still have hope. I said when this first started, we did pull together. We did get through those first 4 weeks or whatever it was. Yeah. I admit now that we're not as together as we were. I wish we were. I wish. I don't know why politics are so crazy.
Let me clarify. People aren't stupid. The stupid people get amplified. They're louder. So you see them and you hear them more than people who can have a rational conversation.
And I still say social media makes it much worse.
It doesn't help. It really doesn't. Again, because you can find people that agree with you 100%, and then you have people who are diametrically opposed to you. So they're just going to clash. There's no discussion. There's just arguing.
Right.
And that never helps. That's the issue.
You can always find something that agrees with you.
Yeah, absolutely.
It seems like it's legit.
Yep. Absolutely. Absolutely, and it's easy to fake stuff, you know. So, and people don't know how to research. They don't know how to look at something critically and see if it's too good to be true. It is. So, just see where it came from.
Well, and then what I don't like is it almost seems like some people are rooting for bad to happen if it helps their side. You know what I mean? Like, woo, look at Florida, the numbers are going through the roof. Yeah. Look at that.
Some people are like that, and some people are also of like the governor should have gotten an apology because he handled it so well at the beginning, and see they were fine and they opened up, and then when the numbers started spiking, people were saying this is what we were trying to tell you was going to happen, and they go, well, yeah.
Well, yeah, I think we all knew it was going to happen. I mean,
and a lot of people didn't think it was. They thought Florida would be okay, hot.
Well, they did. A lot of the experts did think that the heat was going to keep it at bay. So,
yeah, we learned that lesson.
Well, again, the weird thing is you know, you got Cuomo on TV, the you know, not the Governor Cuomo, praising his brother of how well he did, and then going after DeSantis because of you know, they're spiking down there again. And it's like, okay, again, if you look at it, yes, Florida now has more cases than New York does, but they have one quarter the deaths. That's pretty amazing.
It is.
If that's not, and I'm not saying this politically, I'm just saying if that's not good news, I'm not saying that he politically did things correct and Cuomo didn't. There's a lot of variables in those numbers, but to attack DeSantis and say, you know, you're doing this wrong when you know, 4 weeks ago was praising your brother for doing everything right.
Well, first off, he did everything right. The mayor of New York City and the governor of New York City did not do everything right. They were in a unique circumstances because of where they are, because it's New York City, but they also did not handle it right. And other states are benefiting from their mistakes. They're learning how to do things, how to handle when people are sick, and how to whatever else. You know, again, the further we go along, the more we're going to learn, and the better it's going to be.
You know, what's going on in Florida, you know, did we learn how to treat this better? Did we learn? Yeah, we did. And are the numbers of positives going up? Yes. But again, mortality rate is still lower,
which is good.
Which is a good thing. You know, if they came out and said, you know, over the next 1 month, the mortality rate, if they could say this, if they could say, hey, the mortality rate is the lowest it's going to be. If we all go out and get it right now, we can get this over with. And the numbers spiked crazily, but the, you know, very minimal people died. Would it be worth doing? We don't know, but like,
pick who you want to die.
Well, I mean, people are so okay. You know, that's a so if you can get 100 people dying versus 2,000 people dying, is it worth doing? Because you can't control. You know, people are going to die. Like you said, people are going to die.
It's Herman Cain passed away, and they said it was COVID that killed him. But he also had cancer 15 years ago, 20 years ago, whatever it was. So he was one of those people that was susceptible to being high risk. So yes, the COVID killed him, but he was already high risk. Now, you look at that end of it, and then you look at the other end where he didn't believe in wearing a mask, and you go, you've made a choice. And
and he went to the convention, and
so
he's still a human being,
right? Exactly.
We shouldn't say ha ha.
No, and that's my point. That's my point, is not to say, see, good for him, he got it. It's
Right.
that he was high risk. He didn't listen to the science end of it that said you should wear a mask, avoid social distance, and he didn't, and it killed him. And I think people, rather than saying good, glad he's dead, should be saying that's a cautionary tale. If you're in that area, someone's going to die, like you said, but it doesn't have to be you if you're careful and you're following the mitigation. And hopefully, if you do get sick, it's not bad, but you don't know. You just don't know. And I always say this, not even about this. Don't be afraid. Be prepared. Be aware, but don't be afraid about anything. Whether it's terrorists or disease, don't be afraid. Just know what's going on, prepare yourself, and then you have to deal with whatever happens.
Minimize your risks, yeah.
Right, that's all you can do. You drive the speed limit instead of 100 miles an hour, some people, to avoid accident, right?
Well, I drive faster than everybody else to avoid accidents.
Is that you go around the accidents?
It's like social distancing for driving.
Yeah.
Not around another car. What are your chances of wrecking into another car?
Or a tree.
Well, yeah. I have total control, so.
Yeah, of course you do. Of course you do. I've expected nothing less. So that's where we'll leave it. Don't be afraid.
Don't be afraid. Stay safe.
Stay safe.
Know your risks, and mitigate your risks based on what you want to do. Be courteous to other people. We're all in this together. We can get through it.
If you're sick, stay home. And if you're in the government, find a way to take care of these people who have to stay home.
Think about your post before you post it.
Yeah.
I know a lot of people like to anger other people, but
yeah. Think about it twice, and then delete it, and then rewrite it. And then think about it again, because you're going to make somebody mad. Everything makes somebody mad. I don't even try anymore.
Some people get mad no matter what.
Yeah.
I think we should all try to get through this better together. Look out for your fellow man.
And women.
Give people the benefit of the doubt. And just stay safe.
I put something on Facebook tonight about what's the one thing you wish everybody felt as strongly about as you do. And the bunch that I saw before we started doing this tonight, most of it was, other than there were a few oddball ones, but it was be nice to each other. Don't be so offended all the time. Don't be so mad at each other. Just take care of each other, and we'll all get through this. But if we could do that, we would be having a conversation. I'm friends with a lot of people.
And you're friends with, you have more friends than I do on Facebook. I'm friends with, a lot of diverse people from, when I went to high school with people, Trudy was just showing me some online about schools being closed for the first 9 weeks, according to Governor Wolf. I don't know if that's true or not. He's going to announce it, but anyway. So there are, I have people on both sides of the spectrum, some, and it gets tiring, seeing one person post this based on, their belief, and then another person based on this, and then everybody, people saying, oh, these, Democrats are a bunch of idiots and Republicans don't care about anybody but money, and, it just gets, fortunately we don't have a sign of our political party on us somewhere. You know what I mean? Like when we meet people face to face and we can be friends,
right?
And get along, and then, but when politics gets involved, it just it seems like everything goes out the window.
And as much as I like to talk about it, I'd rather not. There are some people that I could agree with.
I think you're right. The two of us can.
Disagree with.
I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I think you're right. The two of us can. I can sit down and have a civil conversation about it, because we know each other so well.
Right.
We know even if we misspeak about something some way, we're not gonna, oh, Glenn hates these kind of people. You know what I mean? Like,
Like you would never vote for a woman for president.
Why do you keep saying that?
You told me that. I don't know.
I never told you that.
Just like there's no such thing. No such thing as breaded pork chops. Because you never heard of them.
I never had one.
Right. So they don't exist.
There's no such thing as a female president, because I never seen
it. No. See? That's why you won't vote for one.
Stop saying that, because it's not true.
It's not true. No, it's not true. It's just one of those things that Craig, I was able to misquote him.
When was that? When did I say that?
Was it the last time we were out? Or time before you said something about it.
It wasn't during college then.
No, the pork chops was college.
Yeah, that was college.
Pork chops for college, yeah. Long time ago. 30 years next year.
No.
Mm-hmm.
It was around 5 years ago. Why do you lie to these people? Glenn and I met in college. He was one of my professors.
See that? See that gray hair? That's 30 years.
Glenn was one of my professors.
You wish.
In college.
I wish. I'd be retired.
He was my prefect.
Yeah, wasn't even that.
He lived there for 20 years. And
that's Joe.
I graduated from college about 5 years ago.
How'd you get through med school in a year? Actually, 6 months.
Yeah, I managed.
I bet you did. No, now we can't take anything you say seriously. Medically, we know you don't have a medical degree.
Everything is about 5 years ago.
Everything is about 5. Feels that way.
Yeah.
How old is your daughter?
And you're not.
Your oldest daughter?
My one daughter's 8 years old.
One of them is. How are the other ones?
I have another daughter. She's 14.
Keep going.
16. And 27.
Yeah. So you're not 30.
I'm a little older than 30.
A little older, yeah. Just a little bit. Yeah. It's okay. Like someone used to tell me, he was older than me, and he'd say, I live this long. You don't know if you will.
It's true.
I'm just happy to get
you are older than me.
I am. Always will be. Till I'm not.
Correct.
Yeah. Just an assumption on my part. Yeah.
Yeah. Okay.
All right. Are we done?
I think we're done.
Okay. Thank you again, Craig.
All right.
If I ever figure out how to do this without the feedback, I won't sound like an idiot half the time.
I was going to say as much.
As much, right. I realize I sound like an idiot a lot, but this isn't helping. Yeah. I can't adjust like I used to.
When are we going to Sharky's?
I don't know. Are they open?
I would assume they're open.
Well,
Westmoreland cut back a little bit, huh?
Yeah, they cut out a little bit. But they serve food there, so
they serve food.
I would assume it's okay.
Well, if you're up for it, let me know.
All right. I'll figure something out.
All right.
Get a hazmat suit.
That's what. So when the debate was whether you were going to send your kids to school with a mask, and all these people were saying, my kids aren't going to wear a mask and blah, blah, blah. So I said to Trudy, I said, what's your thought about this mask thing in schools, And she said, I will buy them hazmat suits if they go to school, if they have to go to school. So.
Do you think your kids will have a problem wearing a mask?
No. Like
we've been them out. I know you've been on stuff.
Yeah, we've done stuff, and they're wearing a mask. So yeah, they're pretty good about it.
I don't think it's going to be as bad as everybody thinks it will be, but I don't know that it's going to be as helpful as everyone thinks it will be either. It's going to be a lot of under the nose and
Well, that's, unfortunately, even myself, I said, I touch my face a lot more than I normally would with a mask on. I'm diligent, though. I use hand sanitizer and wash my hands a lot because that's, anyways, normally what I do, anyways,
right.
Between patients. So, but I do know, the mask, when you're talking to somebody, it moves. It's right. Coming down. You gotta move. You gotta adjust it. So that's the unfortunate thing about them. There's no. Unless we wore like space helmets or something like that.
Yeah. Or if those the N95 masks were available to everybody, and you'd be better off. But that's not a possibility.
They're not comfortable at all.
No, but I mean,
they suck.
Yeah. I read something that
these people that are complaining about wearing these masks, you should actually make them wear an N95 for a half an hour, and they will be like, I'm so glad that I can wear this other mask now. They'd be
someone,
like, give me that
someone
mask.
Posted a picture of one of those gas masks from basic training, where they have to go through the thing, and they said that they had to wear them so long during training, they would take the filters out so they could breathe. Okay. I guess we're done. Gotta learn how to end these things. Have a little song.
And cut.
I guess. I don't know.
That's a wrap.
How to edit this. That's a wrap. You keep moving. It's like you're up, your head's up here, and then your head's down here. Then you lean in, and you're all over the place.
It's on the charger now, so it's sliding around.
That's okay. It's all right. I'll figure it out when I edit it. If I edit it, I might just throw it out there. Be done with it.
Who wants
like
to
6 people watch
the whole thing?
Like 6 people watch. That's I don't even know. Then someone says, "We can do another one." I was like, yeah, all right, we'll do another one.
6 people watch that? That's it.
40 some, 60 some, something like that. Yeah, I don't know how many watched it on Facebook. That was how many you saw it because I loaded it to YouTube. It was easier, and then shared the link. Yeah. So, but
she put out little nuggets of information. You have
I don't have that kind of time. You get what you pay for.
That's right.
Yeah. Okay. All right. Be safe. Everyone, goodbye.
All right.
Bye.
Make sure Michelle's in the video at some point.
I'll try to slip her in there.
All right.
All right. Thank you, Craig.
I don't know how to end this.
What?
I just unplug my phone, I guess.
There you go.
I don't know how to end it.
You're gone.
I know I'm gone because I got out of it, but I still hear you.